Welcome to Startup Health TV. I'm Logan Plaster. Most of us at some point in our lives have to fill out some kind of a healthcare survey, usually handed to us as a stack of papers on a clipboard. Sometimes these include sensitive information like our experiences with anxiety and depression or even abuse, and yet they all look the same and we end up ticking through the boxes as quickly as we can. That means, according to my guest on today's show, that we're probably gathering a lot of bad data. So my guest is Eric Gombrich, the CEO of a company called Tickit Health, which has been with Startup Health since 2013. What Tickit is doing, which is so interesting, is using the science of communication, from word choice to question order to even colors and fonts, to improve the value of the data that we capture. In the interview, Eric and I discuss how they're using these methodologies to improve mental health services for teens, and how this smarter surveying is becoming a backbone for school-based health clinics. As always, if you want to get more of this good news from healthcare's problem solvers, make sure you subscribe to this channel and hit the notification button below. Enjoy the interview.
Crazy.
I'm here with Eric Gombrich, CEO of Tickit Health. Eric, thank you so much for taking the time with me today on Startup Health TV.
It's my pleasure. I'm looking forward to the conversation.
So Tickit Health, it does a lot of things, but it helps a diverse range of companies kind of collect better data on the populations that they work with. But before we get into the actual product and kind of what that means, I want to ask you about something that I saw on your website. You talk about gathering data based on digital empathy. You make a big deal about this idea of digital empathy. And so I want to just start with that. Just what does that term mean to you and why is that so important?
Yeah, great question. Thank you for asking it. We consider it kind of the secret sauce of what we're doing in the solutions that we're delivering to our clients. It really gets to the essence of the fact that when an organization, and obviously we're talking about healthcare in particular here, but it extends into other industries as well. When they try to get data from their, I'm going to say clients, healthcare would be patients, they tend to develop the questions that they're asking based on, of course, the data that they want. But they then don't go to the next step to define or think about how are we asking the question and how is that going to be perceived by the person that's being asked the question. And so digital empathy is all about doing just that, particularly in a digital context. For example, if we're sending out surveys or assessments, questionnaires, really being thoughtful and intentional in how are we asking the question, and perhaps it needs to change a little bit as we move through different genders, ethnicities, age groups, contexts, etc. And that's something that we have found over the past 12 years, organizations, quite honestly, do a very poor job of, and it's resulting in very poor returns on their efforts to get data from patients and their clients. And so that's really the essence of digital empathy. How do you fix that?
Okay, so healthcare surveying that really focuses on how you ask questions, not just the words that you're saying or what you're asking. Okay, so that's kind of the framework, our mindset. Now just give us the flyover of what Tickit Health is. If someone had never heard of them, of the company before, what is it, and what are you building?
Sure. So founded by a pediatrician, born out of her experiences on the front line in the emergency department of trying to get information from her patients, and many times, the majority of times in the pediatric context, of course, they may be actually sitting next to a parent or something, and so doing something like just asking a question, do you smoke? Do you vape? Do you drink? Do you use drugs? Do you smoke marijuana? Things like that. Well, if mom is sitting next to me, what's the answer going to be? And so, consider the fact that, wait a second, maybe this isn't the right time or place or way to ask the question. Perhaps if we handed the child a tablet before they walk into the exam room and allow them to answer the question in their own private way without mom looking over the shoulder, I'm going to get more accurate information. And so Tickit is a SaaS-based solution to do just that. Deliver better ways of asking these questions for the different patients in the different contexts that we have proven over the last 12 years results in better data. We get much higher response rates to assessments, questionnaires, surveys. We get much more accurate data in the process. And it's dramatically improving the productivity of the organizations who are asking the questions. And that includes the physicians. Encounters are getting shorter, they're getting more information to be able to act on. And so that's what Tickit is. It is this SaaS-based solution to do just that.
The example that you gave, the strategy of just saying, okay, maybe we need to be in a different room using a tablet versus verbal, is a great sort of concrete example of sort of working smarter, not harder,
Right.
just thinking
Right.
through the process. What are some of the other, what are some other strategies that come to mind that fall into that same category of how you ask versus what you ask?
Yeah. For example, many of the validated assessments or questionnaires that are used in healthcare, a lot of them are, mental health, but they get into social determinant issues and things like that. Many of the standardized validated ones are already embedded in many of the EHRs like Epic and Cerner and Meditech and whatnot. But that requires, quite honestly, the clinician to do an interview process, ask the question, and it may be the physician, it may be the nurse, whatever the case is. But when that happens, not only do you have the risk of the example I just gave, if the patient is sitting next to their parents, they may not be forthright. But even if it's an adult patient in an encounter all by themselves, that interview can actually skew the data. I had a great example of this provided to me a couple weeks ago while we were talking to a prospect, and one of the young women in the audience indicated, this just happened to me 2 days ago. I had an encounter. I had never met the patient before, and within the first 3 minutes, I was asked, what is your sex life with your husband? And I had just shut down at that point because I hadn't established this level of trust with the clinician yet.
Gotcha.
I didn't know why the question was being asked. And so after that, I was on the defensive, and every other question that was being asked, I was reticent in providing forthright information.
Okay.
And so one is by decoupling it from the actual encounter. So perhaps we can send the questionnaire as part of the appointment reminder or as part of the confirmation in the appointment. So again, the data is captured ahead of time. Now the provider has that information walking into the encounter. Another example is the ability to deliver it digitally through email, SMS, portals, et cetera, as part of the whole telehealth initiative. Again, right now, most of this questioning is happening on a clipboard or in an interview context, which requires that physical proximity. Gotcha. And it adds burden and labor onto the staff. And even worse, it's polluting the data because of these biases in the way that the questions are being asked.
Very interesting. So you've been with a Tickit for, I think, under 2 years, coming on 2 years, and you came from another startup health company,
Yep.
Cloudbreak. What was it about this mission that really resonated with you?
Yeah, well, interesting. In my history with Tickit goes back to their founding in 2011. I actually worked with them on building their original business plan, their go-to-market strategy. And I remained as an advisor. This is something that was disclosed to all my other employers in the process. They had no issues with it, no conflicts. But when I did leave Cloudbreak in June of 2019, the board and the CEO, founder, chief medical officer of Tickit asked if I could step in and help them more in a CEO and a commercialization side of things. And I jumped at the chance because I think there's a real opportunity in the data that Tickit is now bringing forward from its customers in the US, Canada, Australia. Those are the 3 countries we're live in right now, is really compelling, showing the productivity gains and the quality of the data gains. And we're starting to see this resonate, particularly in the context of mental health becoming something that's exploding across the environment. And so I've been honored to be a part of the team and join it in that capacity. So that's what got me involved.
Now, you intuited that this sort of framework could apply in a variety of places, but you've also mentioned working with youth, with teens, school-age children in the mental health space. Mental health platforms have exploded, but not so much in the youth market and in schools. Why is that such a critical place to begin providing better mental health services?
Yeah, it's a great question, and it gets right to where we're seeing significant growth in our business. Our customer base is at that nexus of education and healthcare. And so when you think about it, if you are a healthcare provider, you tend to think generally in the context of encounters and diagnoses and things along those lines. But if you step back for a second and think about a patient-centric view of this, your patient is somebody else's student. And that organization, that school, is dealing with these same mental health issues. They're dealing with the anxiety and depression and whatnot that has been there for a long time, but it's really starting to accelerate because of the pandemic, of course, and the isolation, the virtual learning and whatnot that has ensued. But again, the school counselors don't have the benefit of walking down the hallways and seeing a student and seeing that they appear distressed and saying, hey, why don't you come to my office for 15 minutes or 20 minutes? That engagement is kind of fallen apart as well. And so now the educators are trying to figure out, how do we get in front of this? But they're not necessarily equipped to do it. They don't have the psychologists. They may not have enough counselors. And so we're seeing this drawing together, or as I say, this convergence of healthcare, where we're seeing school-based health centers, which are based in the schools, typically run by the local hospital or the local health system, starting to more proactively do things like screen the kids around anxiety, depression, suicide risk, trauma, social and emotional learning needs, things along those lines. And so this convergence is a really exciting thing. And we sit right at the epicenter of it, because it's largely about doing these assessments, these questionnaires, these surveys.
Got it. Where do you see, I mean, obviously it's such a shakeup year for schools, for the public school system. Where do you see school-based health systems moving in 2021? How do you see that convergence changing? How big of a part of Tickit will that be going forward?
Well, it's our prediction that we're going to see substantial growth in whether they are technically school-based health centers, which is a designate out of CMS, or things that are similar to that, where the schools, the school districts are now more tightly aligning with local health resources, because they're starting to realize, if we don't deal with the anxiety, the depression, whatnot that these kids have, we're at the academic performance that we absolutely must get, or we're not meeting our mandate as a school district or a school. And so they're starting to realize this is kind of in the realm of a social determinant issue that is impeding the outcomes that the school is pursuing. And so we're seeing some very innovative models and looking at, how do schools or school districts align with health systems, or how does the Department of Education at a state level or a county level start to leverage relationships with telepsych providers, telehealth providers, things along those lines. So we're seeing this manifest in a number of different ways. We're seeing federally qualified health centers partner with schools. So it's not just that school-based health center, but just this general convergence of healthcare and education.
The need for that collaboration between health centers and schools seems so dire. It seems so necessary. And what I'm hearing from you is that you're sitting at the center because you're allowing them to gather the data they need to connect the dots between those two worlds. Right. Do the surveying, get the knowledge that connects, and yet, what a big, important challenge to connect those two worlds. I mean, you mentioned social determinants of health. I know there are people on both sides of this equation who are both looking at those issues and saying, how can we go beyond our typical thinking about education and health? What are the bigger factors? So to have the knowledge needed, so essential.
And there's a slightly different vernacular between the health sector and the education sector. So in healthcare, we refer to social determinants of health, and I think that's an exploding area of interest for health systems, particularly if they're carrying any financial risk and outcomes risk associated with their business models. But if you step over to the education side, they refer to social and emotional learning needs of students. This is dealing with the fact that a student may be bullying other students on the playground, or maybe being bullied themselves. They may be suffering from trauma. They may have food insecurities or shelter insecurities at home. They may not have access to internet. So don't tell me I need to do my coursework online. I mean, these are all the exact same things. They're just looked at through a different lens with a different vernacular. And I think there are huge opportunities for us, and this is part of what you can see gets me passionate. If the two come together and collaborate, because the schools are running around saying we don't have counselors, we don't have psychologists, we don't have psychiatrists, and meanwhile you've got the health system that's saying, look, if we don't deal with these things earlier, they become so acute that they tip over into clinical diagnoses, and now we have to deal with these things as well. And as you know, as we like to refer to, your patient is my person. And if the two different domains can come together around that patient-centric model or student-centric model, I think there are great gains that can be had. And that's right where we sit.
It makes a lot of sense. Not that that area isn't big enough, but I can imagine so many other applications for this idea of digital empathy and thinking smarter about how we survey people about health. Looking ahead at 2021 or even the following year, do you see this applying to other industries or other areas?
Yeah, absolutely. And it's not even looking forward. We're already doing it with other industries. For example, the Canadian Red Cross is using us as the front end of their disaster management system. So when they go into a disaster, again, you've got somebody in a vulnerable state. They may not be thinking clearly. They are traumatized. They're anxious. But the Red Cross needs to get some specific data from them. For example, how do we communicate with you? So it's as simple as just asking perhaps a cell phone number, presuming the cell tower is still functional, or where are they temporarily located? But it also gets into things like, do you have any medications that you've lost that you need to have replaced? Do you need shelter? Do you need clothing? Are there other members of your household, whether it be human or pet, that are missing? They need to collect all of this information as part of the disaster service that they provide. And again, having a more empathetic approach to this when this person is in this vulnerable state is something that can demonstrate much better results in getting accurate data from them. We're being used by organizations that are supporting homeless individuals along the same lines. What do you need from us? What can we provide to you? How do we get in touch with you? We are being used by organizations with adult populations in healthcare in particular. We're being used by employers to assess their employees for perhaps mental health issues, or even in educating them and validating their awareness and comprehension of the education on safety under OSHA, for example, the OSHA training that they're doing. Taking a more empathetic, considered approach to this whole process is proving to work and have a real profound impact on the outcomes for everybody. So we're really excited about seeing it grow in multiple directions.
Very interesting. One of the things that's always fascinated me about Tickit, because I've interviewed the folks at the company over the last few years, is the focus on understanding the science of communication and really this idea of evidence-based communication. And I know that the founder, studied it. There's multiple people at the company who really got into, what makes communication work. And I wonder if you could speak to that briefly and just why is it important in this day and age to really kind of have an evidence-backed model, even with something that people used to think was simple. Just ask a question, right? Just get an answer.
Yeah, absolutely. So you're asking about, again, the digital empathy, what we call design framework. And so it's one of the things that we are doing routinely, and it's really what we think is the core of this whole solution. Is researching and validating things. What are the right colors or fonts to use? What's the right vernacular? What's the right font size, for example, with a different population? What imagery might work? And one example that I use, and it's a generalized example, but I think it gets the point across to our listeners, is if I am asking questions of somebody that may come from an East Indian background or an Eastern Asian background, where white is actually the color of death. In the Western world, it's black, but in these parts of the world, it's white. If you're asking somebody these questions, either on a piece of paper, white paper, black text, or even on a generic survey type of approach on a white background, black text, you may not even realize that you might be triggering some biochemical responses in their brain without even realizing it. That is making them anxious just in the process of asking them questions. And so just imagine the survey that you're doing is an HCAP survey, or a satisfaction survey generally. If you start asking questions in a way that makes the person anxious just in the survey itself, what do you think is going to be the impact on the results of the survey? And we see this day in and day out. And so we work with researchers around the world validating these studies. We've also taken some of the validated tools that are well known in healthcare, for example, the PHQ-9, which is General Mental Health Screener. We've taken that set of questions, applied digital empathy to it on the Tickit platform, and that's where we're seeing the results of this performance accelerate.
I love it. I love it. I think it's very inspiring to see, using that evidence to work smarter with data collection. As we close up our time, what's a profile of an ideal partner for Tickit Health? Who are you hoping to work with, and what would that look like to reach out to you?
Well, I think first of all, what I would say is I think there's applicability, everywhere around this. But the organizations that we tend to see really rapid uptake with are the ones that are realizing the importance of getting accurate data from their patient populations. And it could be a subpopulation. It could be one department around one particular disease or condition or whatever the case is. But generally, it's these organizations that realize, wait a second, the more accurate data we get from our patients, the better we're going to be able to perform, both clinically and financially. Those are the organizations that seem to really lean in on the digitally empathetic approach and recognize the value of what we're doing. We can be reached at tickethealth.com. On the web is our website. You can follow us on Twitter. You can follow us on LinkedIn. And
I'll put all that in the description for the video.
Perfect. Yeah. That'll be great for people to reach out to us. We'd love to hear from you if you're interested in doing this, and particularly if you're dealing with people that you feel might be in a vulnerable state and therefore already on the defensive or reticent to share information with you. That's where we're shining.
Eric, thank you so much for your time. So many great applications for this technology. And from my vantage point, talking to healthcare startups, it's a unique application, and what you're doing is needed and important. So thank you. And I'm looking forward to seeing what you do in 2021.
That's great. Thanks, Logan. Appreciate it.
All right. Take care. Be well.
Thanks. Bye-bye.
Bye.